The measurement of vital signs, sometimes abbreviated VS, is an important part of patient care because it reflects the physical well-being of the patients that you're taking care of. Hi, I'm Kathy Getrust, and today's topic of conversation is going to be on pulse, respiration, height, and weight. Pulse and respiration, along with temperature and blood pressure, and more recently pain, are considered the vital signs. We're going to be discussing height and weight today as well. Height and weight really are not considered to be vital signs, except that they're frequently done at the same time as vital signs are done, so that's why we're discussing them jointly. Well, what is pulse? Pulse refers to the number of heartbeats per minute. Pulse is the pressure of blood that is felt against the wall of an artery in the heart, alternately contracting, which is when the heart is beating, and when the heart relaxes or rests. The pulse is more easily felt in arteries that come closer to the skin. However, the arteries reflect pulse regardless of where it is in the body, deeper or close to the skin as well. The pulse is an indication of how the cardiovascular system is meeting or not meeting the patient's needs. There are many places called pulse points where a pulse can be felt. The most common ones are the carotid pulse, and the carotid pulse is at the neck. There's the apical pulse, the pulse that is heard and felt at the heart, and the one that you will use most frequently called the radial pulse. The radial pulse is at the wrist. This radial artery at the wrist is on the thumb side of the wrist, and I'd like you to see if you can find your radial pulse. If you look at your hand and have it palm side up, locate your thumb and move your opposite hand down the thumb to the center of your wrist, and if you put 3 fingers across your wrist, most likely you will be able to palpate or feel your pulse that's beating in the radial artery on the thumb side of the wrist. There are a number of things that you need to observe when you are taking the pulse. The first, of course, is the rate. What's the speed, or how fast is the pulse going? And that's determined in beats per minute. The other thing you want to determine is the rhythm of the pulse. Is it a regular boom, 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 boom rhythm, or is it irregular? Boom, 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 boom. There is no natural rhythm to that. It's important to note whether it's regular or irregular. The third thing is the force. How strong a pulse are you feeling at the wrist? Is it weak? Sometimes it's called thready. Or is it strong? Is it bounding, kind of a pulse where you can literally see the pulse? There are many factors that affect the pulse variations. Some of the reasons why a pulse will be increased is due to exercise, heat, stress, pain, and certain drugs. There's also a number of reasons why a pulse rate might be decreased. Some of those things would be when we're at rest, when we're feeling very relaxed, when we're asleep. People with certain heart diseases will have maybe a slower pulse. And again, drugs can conversely cause an increase in pulse rate as well as a decrease. Some important things to remember with pulse measurement. A change in one of the vital signs will frequently cause a change in another. For example, when the body temperature rises, it's usual that the pulse and the respirations as well will also rise with it. The normal pulse rate will change with age. Infants, for example, have a very fast pulse rate. It can be from 120 beats a minute clear up to 160 beats a minute. And as we age, it slows down. The adult pulse rate range is between 60 and 100 beats per minute. You would want to report any pulse rate that was above or below that normal range of 60 to 100 beats per minute. Along with reporting that change in rate, you would also want to report any irregular pulse, including the rhythm and force, immediately to the nurse or person in charge. It's important to use gentle pressure, especially if a patient's pulse is weak, because pressing too hard on the pulse may eliminate your ability to feel it. So try not to use too much pressure when you are trying to locate the pulse. If you have difficulty obtaining a pulse and you just can't feel it, or you might be able to feel it for a little bit and then it seems to fade away, try the person's other wrist. Lots of times there is an ability on one wrist to feel a pulse much more capably than on the other. Never use your thumb to locate a pulse. And the reason for that is that our thumb has a pulse that is felt very near the skin, and it can be confused with the pulse that you're trying to determine from the patient. To take a pulse and respiration that we'll be talking about a little bit more in a bit, you'll need to use a watch with a second hand. In many of your facilities, you will have a watch, much like you're seeing here, that has a sweep hand. It's a large, old-fashioned kind of a clock. If you don't have that in the patient room, you would probably want to use a watch similar to the one that I have here. I have one that's quite large. It has a second hand. It has all of the numbers on it rather than just lines, and it makes it very easy for me to accurately check a pulse without any confusion that it might be incorrect. Now I'd like you to watch a demonstration of taking a radial pulse. Taking a radial pulse. Wash your hands. Position comfortably with arm resting on a flat surface or across the chest. Use the first 3 fingers to locate the radial artery on the palm side of the wrist in line with the thumb. With a watch, count the radial pulse for 60 seconds. If the pulse is regular, you may count for 30 seconds and multiply times 2. Measure the rate, rhythm, and force of pulse. Record the measurement on a notepad. Wash your hands. Report to the nurse any deviations from normal. Now that you've seen the demonstration on taking a radial pulse, I'd like to move on to respirations. Respirations is the process of breathing oxygen in and carbon dioxide out of the lungs. One respiration consists of one inspiration, that means breathing in, and one expiration, or sometimes called exhalation, which is breathing out. The chest rises during inspiration and it falls during expiration. When counting respirations, count 1 respiration each time the chest rises and falls. And I'd like to just show you what that would look like. This will be the breathing in part and the exhalation. Those two together is considered 1 respiration. Observations to make when you're taking someone's respiration in addition to the speed or the rate at which it's going is whether or not the respirations are deep or shallow. Deep respirations allow for a good exchange of air. That would be considered a deep respiration. A shallow respiration would be very minimal exchange of air and can be troublesome and is something worth reporting to the nurse. Do both sides of the chest rise together? Both lungs should be working together and in symmetry. Are the respirations evenly spaced and in regular rhythm? Normal breathing should be regular and even. Does the patient have dyspnea? Dyspnea means difficulty with breathing. Breathing should not be difficult. It should be painless and it should be easy for the individual. Are there any unusual sounds like wheezes, gurgles, coughs, rattles? All those things are abnormal. Normal breathing is quiet, and any of those extra sounds should be reported. When counting respirations, you would count for 1 full minute, unless the respirations were quiet and comfortable, and in that instance, it would be perfectly all right for you to count the respiration for 30 seconds and then multiply times 2. If you have any question about the regularity of the respiration, then it's safer for you to count it for the full 60 seconds. There are a number of factors that affect respiration changes. Some of the ones that will cause an increase in respiration would be exercise, such as jogging or running. An elevated temperature will cause an increase in respiratory rate, as well as respiratory illnesses, such as asthma will cause an increase in respiration. There are factors that also decrease the rate of respiration. Drugs, the narcotics such as morphine as a class of drugs that frequently will cause a decrease in respiratory rate. The elderly typically have slower respirations, and those that are terminally ill and near death. Some points to remember with respirations. It's very important for you to count the respirations of an individual without their awareness. Otherwise, they may change the pattern of their breathing. So to best do this, it's useful if you take the person's pulse rate first, and when they're finished, keep your hand in place at the wrist as though you were continuing to take their pulse, with continued pressure applied to the wrist. But the difference is that your eyes would glance up towards the chest, and then you would be observing their respirations. But you would keep your hand at the wrist, continuing to put pressure on it as though you were continuing to take their pulse. And the patient will probably assume that you are continuing to take their pulse, and they will continue then to breathe normally. The normal range of respirations is between 16 and 20 a minute. You would want to be sure to report any rate above or below that normal range, along with any other observations about breathing. Now please watch a demonstration of counting respirations. Counting respirations. Wash your hands. Position as for a pulse, sitting or lying comfortably. When finishing counting the pulse, continue to hold the wrist. Count the number of times the chest rises and falls in 60 seconds. If regular, may count for 30 seconds and multiply times 2. Record on a notepad the number and regularity of the respiration. Report any deviations from normal. Wash your hands. Now that you've seen that demonstration on counting respirations, I'd like to talk a minute about reporting and recording of vital signs. Always record the measurements as soon as possible. The longer you wait, the more likely it is that a mistake in reading may have been made. You might forget exactly what it was that you obtained in your recording, in your measurements, and so it's important to record quickly as possible. Carry a small notepad so that vital signs can be jotted down as soon as possible after they've been obtained. Check to be sure that the right measurement is charted in the right place for the right patient. Record in the right place. Some facilities chart on computers, while others will continue to record on graphic or flow sheets. Vital signs are abbreviated and almost always are in the following order: temperature first, followed by pulse, and thirdly, respiration. If a blood pressure has been obtained, it is either before the temperature or is placed after the respiration. Report any deviations from normal to the nurse. Patients have a right to know information regarding their vital sign measurement. Follow the facility policy, as some institutions prefer that a nurse discuss the vital sign measurement with the patient. Now I'd like to move on and discuss some information about height and weight measurement. Changes in weight particularly are frequently used as an indicator of a patient's condition. Baseline, also called the original measurement of height and weight, is usually obtained on every patient's hospital or admission to long-term care or home health. Weights are frequently measured when patients are given certain drugs, an example being a diuretic, where there is an attempt to have the patient have an increase in urinary output to get rid of excess fluid. They will want to be checking the weight on a very regular day-to-day basis to determine whether or not the medication is actually being effective in doing that. Weight is also an indicator of the nutritional status of the patient. Height may be recorded in feet and inches, or it might be in centimeters. Weight may be recorded in pounds and ounces, or it might be in kilograms. So you need to follow the policy of the facility where you're working and their recording guidelines, because they do vary from place to place. There are different kinds of scales for weighing people. The most commonly used scale is the upright scale. This scale is used for people who are able to be ambulatory, walk around freely, and who can stand unattended on a platform. It's used to measure both the height and the weight of the individual. Another type of scale is called a chair scale. A chair scale is used for patients who cannot stand independently on an upright scale. This might be a chair that is actually a chair that they come and sit down on, or it might be a platform that they have a wheelchair just pushed onto, but they nonetheless stay in a seated position. This chair scale does not have the ability to measure the person's height, only the weight. The third type of a scale is called a mechanical lift, and this is used for patients who are not ambulatory or are too heavy or too difficult for them to move easily. And in those instances, a mechanical lift will be used. Again, that is only for the measurement of weight. Cannot measure a height with a mechanical lift. Some points to remember with height and weight determination. Measurements really have to be accurate in order to be useful. Physicians and nurses are going to rely heavily on the information that you obtain. Much of the treatment, medical treatment, will be based on the accuracy of your weights, and the vital signs as well. So be sure that you're very careful in obtaining the measurement. If you obtain a weight today that is very different from what you obtained yesterday and preceding days, there's probably something wrong with the measurement. And rather than just recording that, let's just say yesterday it was 132, today you get 114. Well, common sense tells us that that's probably an inaccurate reading. And so think about that and determine what might be the cause and check that weight another time. Weigh the same time each day. Weight varies during different periods of the day, so it's important to be consistent in weighing the patient at the same time. Also, the person should wear the same amount and type of clothing each time they're weighed. For example, if a patient is in a bathrobe and slippers today for a weight, then they should be in a bathrobe and slippers tomorrow for the weight as well. The other thing is that you need to use the same type of scale for each measurement so that there's accuracy from day to day. Now, I'd like you please to watch two demonstrations. The first demonstration is going to be measuring the height and weight on an upright scale, and immediately following that, there will be a demonstration of measuring a weight utilizing a standing lift. Measuring height and weight on an upright scale. Ascertain the previous weight, type of scale used, and the time the patient was weighed. Wash your hands. Balance the scale. Place the large weight and the small weight indicators at 0. The balance bar should be balanced in the center. If not, use the balance adjustment to bring the scale to balance. Place a paper towel on the platform. Assist onto the scale with the same amount of clothing as previous weight. Have patient's arms at their side. Patient should not hold the bar or other part of the scale. Adjust the weight until the scale is in balance. Move the larger weight until the pointer drops to the bottom of the square. Then move the larger weight backward 1 notch. Move the smaller weight until the pointer balances in the middle of the square. Add the larger and smaller weight measurements together. Make a mental note of the weight. Adjust the height bar on the scale to rest on the patient's head. Read the number at the movable part of the ruler section. Convert the total inches to feet and inches. Assist the patient off the scale. Record the measurements on the appropriate chart record. Make sure to remove the paper towel. Wash your hands. Report to the nurse any deviations from the patient's original weight. Measuring weight on a standing lift. Wash your hands. Bring the lift to the bedside and widen the base. Explain the procedure to the patient. Zero the scale per manufacturer's instructions. Attach the sling to the lift and anything else that needs to be subtracted from the final weight. Make note of the additional weight. Remove the sling from the Y-beam and place around the patient. Buckle the security strap snugly. Assist the patient's feet onto the footboard. Maneuver the lift against the shins of the legs. Lock the brakes. Attach the sling to the J-hooks. Place the patient's hands on the handlebars. Then secure the leg straps. The first caregiver stands near the control panel while the second caregiver remains close to the patient. Using the control, raise the patient by pressing the up button. Continue to raise until the patient clears the bed. Let the weight steady and record the reading. Do not touch the lift or the patient being weighed, as a false reading will be obtained. Return the patient to the bed or to a chair as desired. Remember to subtract the weight from the sling, then record on the permanent record, including the time, weight, and the scale used. Wash your hands.